Hi, I am Logan Brown, and I did my presentation on interleukin-1 receptor antagonist protein. It's also known as IRAP. My question asked is the study of IRAP, is the use of IRAP effective for the treatment of joint disease and joint issues in animals? So it's used a lot in equine, but it's also used in other animals. I wanted to do this study because I recently started working for an equine vet, and she uses this a lot, so I wanted to learn more about it and how it works. What is IRAP and how does it work? It's an anti-inflammatory treatment for animals with joint disease. It stimulates the white blood cells to produce anti-inflammatory mediators. So it potentially blocks the interleukin-1 protein. The interleukin-1 protein is what initially causes inflammation and then sends out a signal to other harmful chemicals that cause more inflammation and more joint disease. So the interleukin-1 protein, the receptor antagonist protein, binds, so it's blocking the interleukin-1 receptor from binding as well. So it's able to counteract the harmful effect that interleukin-1 does. And this model over here just demonstrates the interleukin-1 receptor antagonist protein binding. 90% of it has to be mostly occupied for it to work and not cause any inflammation or joint disease. Why is IRAP used? So it's used for animals that have joint diseases like osteoarthritis. It's actually used to treat the cause of inflammation, and it restores the joint damage and cartilage function to the joint. So one of the studies says our clinic has seen the resolution of lameness, a general improvement in the range of motion of the joint, and a decrease in joint effusion in treated horses. So usually in horses you inject cortisol and you do that repeatedly. Most of the time you have to keep doing them and then it gets sooner and sooner. So you're only suppressing the issue with the cortisol. IRAP is actually treating it and curing it. So you're treating the issue at hand and then you're also restoring the cartilage function and the joint damage in the joint. So it works very well. How is IRAP prepared? From horses, it's collected from the jugular vein. You can collect blood from the jugular vein, and it's around 50 to 60 mils that you collect. So you have to collect from the horse that you're going to be injecting into the joint with. So you have to use the horse that is hurt and that you're going to be injecting. So it's then incubated for 24 hours in a syringe that contains these glass beads. The beads induce the white blood cells to produce the interleukin receptor antagonist and then cytokines as well, which has the healing proteins. The blood is then centrifuged and the serum is collected off in different doses depending on where you're injecting and how much you need to get. And then there's usually about 3 doses of serum that you need because you're going to be doing 3 injections. So you inject the joint you're working with and you repeat every 7 days for 3 injections. So every week you'll repeat, and then after, if the 3rd injection did not work, it's determined by your vet if you need to continue injections or what the next step is that you need to go into. So when drawing the blood and injecting into the joint, the environment has to be extremely sterile to decrease the risk of infection since you're going to be injecting into a joint. The serum and extra serum that you get off can be frozen and stored for 12 months. When it's injected, it actually stimulates the cartilage cells in the joint and repairs them, and it reduces the inflammation in the joint as well. So it has a combination effect, reducing the inflammation and restoring the cartilage development. So one of the studies that I read about was synovial fluid and serum concentrations of interleukin-1 receptor antagonist and interleukin-1 in naturally occurring equine osteoarthritis and septic arthritis. So the study was conducted on 40 horses to determine if the levels of the interleukin-1 receptor antagonist protein and the interleukin-1 in serum and synovial fluid would be able to determine if this was a successful way of determining the severity of joint disease. So one of the ways to diagnose joint disease is to measure the level of synovial fluid. So they wanted to see if this was a way to be able to see if they could diagnose. So the horses studied had mild osteoarthritis, advanced osteoarthritis, and septic arthritis. Healthy horses were used as a control group. So it was found that there was a significant difference in the interleukin-1 receptor antagonist in healthy horses and then horses with osteoarthritis. So there was a high concentration in the horses with mild and advanced, but even a higher concentration in horses with septic arthritis. So the study found that modern equine-specific ELISA tests have improved our capability to detect levels of the biochemical parameters and allow us to correlate them more accurately with the severity of clinical osteoarthritis. So it was concluded the amount of the IRAP in the synovial fluid results reflects the severity of the joint disease in horses, so it can be used to measure to clinically diagnose that. Early intervention, another study that I found was early intervention with interleukin-1 receptor, measuring the microRNA and the mRNA expression in cartilage after impact injury. So in this study, an ex vivo porcine knee was studied, and a 10 kilogram weight was dropped on right above the knee, and then was injected with the IRAP 1 hour after the injury. 8 hours after the injury, cartilage samples were collected to analyze. In the study, these findings support the potential of IRAP treatment as an early intervention strategy for the prevention of cartilage degeneration after the impact injury. So it worked very well. And so what's that saying? They can use this right when an injury happens and use that to prevent further damage. And then here's just a model that describes the difference with just injury and then with the treatment. So the ADAMTS5 and ADAMTS4, these are enzymes that are involved in the degradation of cartilage and arthritis. And then the MIR140 and MIR125, they have anti-inflammatory effects. So it's the exact opposite what needs to happen. These are downgraded and these are upregulated. So this is causing the degradation of cartilage, and this is causing inflammation. So exact opposite in the IRAP treatment. The enzymes that cause the degradation are downregulated, and then the proteins that have anti-inflammatory effects are upregulated. Sorry. Get my dog. So clinical, biochemical, and histological effects of intra-articular administration of the serum in horses that are experimented included osteoarthritis. So a study was conducted on 16 horses. 8 horses were injected with the IRAP treatment, and the other 8 horses were injected with saline. They researched clinical findings, synovial fluid, gross observation, and histological examination. So the results off of this study found that there was no adverse effect of the treatment. The findings resulted in a huge decrease in lameness. In the horses that were treated with the IRAP, there was a significant decrease in synovial membrane hyperplasia, and there was a less cartilage fibrillation and less synovial membrane hemorrhage. So it worked very well. There was less cartilage that was defibrated, so that means that the cartilage was regenerated, less hemorrhage, so less blood. The study says in the present study involving induction of osteoarthritis in the middle carpal joint of horses, significant improvement in the clinical lameness and decreased pathological changes within the synovial membrane of the osteoarthritis affected joints after the treatment were detected, compared with the findings with the placebo. So this was a successful study using the IRAP for the treatment in joint disease. Another study that I found that was conducted on mice and in equine. In mice, a cruciate ligament transection was performed, and then 3 days the joint injection was given, so the treatment. 2 months later, the mice were evaluated and the joints were collected to evaluate the cartilage and tissue damage In the horses, an osteochondral chip fragment surgery was performed, and then 5 days after that, the joint was injected. The horses were exercised 5 days a week, very vigorously, and then every 7 days they had lameness exams. They assessed the synovial fluid and limb, and the blood and serum was analyzed. After 72 days of that, the joints were harvested. So the results from that, in mice, it was shown that there was a less cartilage loss and the joint injection performed, so it protected against more loss of the cartilage. In horses, it was shown that there's a huge improvement in the lameness, and then there was a successful relief of pain. There was no biodistribution outside the joint, so it seemed to be very well tolerated with the horses. The study reported, taken together, these data demonstrate efficacy for use of inflammation-inducible, so as a symptomatic and disease-modifying agent. This worked very well. Conclusion, IRAP is a new regenerative medicine that's being used mostly in the equine industry and has had very successful discoveries. The use of IRAP is successful in treating joint diseases like osteoarthritis and successfully brings down the inflammation and generates healthy cartilage. So the research done in the presented studies that I shown above, they had very successful results. So it's most successful in horses that have mild to moderate joint disease, not extreme. So it's not recommended to use in horses that have chip fragments. After the removal of those chip fragments, it works very well, but the IRAP allows for a better quality of life and allows horses to be used longer, for they are having to retire because of joint disease.